Good afternoon, and today I have a pleasure of interviewing my friend Lisa Paladino. She is a registered nurse, but also she's a tongue tie consultant and lactation specialist. And she's author of two books on a controversial poem, tongue tie, and breastfeeding with the tongue tie. We shouldn't do the tongue tie. And she's gonna show us her recent book, which is gonna be on Kindle very shortly, and everybody have a chance to read it. So, good afternoon, Lisa.
Good afternoon. Thank you so much for having me. This is a pleasure.
And in this conversation, we're gonna talk about can tongue tie influence child breathing, spatial development, feeding, sleep for years to come, and is breastfeeding is the first step of developing lifelong airway health. And since Lisa, she's really certified to talk about that. She's certified nurse midwife, lactation consultant, tongue tie expert, and author. And she's going to talk about the latest evidence surrounding controversial topic of a tongue tie, breastfeeding, frenectomy, and infant airway development. So please stay tuned. And I'm going to ask Lisa the first question. In my book, yes, I talk about that. I have two boys. Topic of breastfeeding really close to my heart. Topic of tongue tie really is very close to my heart because I had it done as a child in age 4. It was important, and I'm still thankful to my mom. I really didn't like the experience, but it was nice. And in my book, of course, I include the chapters on that topic. So it's very controversial. Why? Why do you think it's still disagreement between pediatricians, lactation specialists, ENT, dentists, speech language pathologists over this issue despite of growing research? And of course, New York Times illuminate this.
Yeah, so I agree it's still controversial, and maybe it needs to be controversial before it's accepted. Let's put it that way. But the reason why it's controversial is just those different disciplines that you just mentioned. Dentists, doctors, pediatricians, ENTs, midwives, we all learn separately, right? So as a midwife, I didn't even learn as much about breastfeeding as I needed to learn, right? Doctors certainly don't learn enough about breastfeeding. Dentists, I had no idea what a dentist did or knew, right? Speech language pathologists are in the picture, myofunctional therapists, occupational therapists, physical therapists. We all learn separately. So we also all listen to our own research of our own field. There's very little interdisciplinary learning. There's almost no interdisciplinary research. So we base our opinions on what we have learned and what the research by our profession has shown. And that's where very good example was the American Academy of Pediatrics position paper on Ankyloglossia or tongue tie was all based on pediatric studies and missed a whole bunch of research that's being done. So, we have to look behind, but beyond the silos. It's one of the reasons that in all of my courses I include anyone who wants to learn. Right? It's not just for midwives. It's not just for lactation consultants. It's for everyone because we need to learn together. When we learn together, we understand each other. We know how to refer to each other. We know how to trust each other. And most importantly, the patient gets holistic care of feeling and trusting that their doctor or their dentist or their lactation consultant and all of the team is talking to each other and helping them as a team. Right. So I think that's where the controversy, I know that was a long-winded answer, but I think the controversy roots back to the separateness that we have. And we have to stop that. We have to learn together. Here you are, a dentist talking to an RN, midwife, IBCLC, right? That's what we need to do. We have to have conversations so that we learn each other's craft, we learn each other's weaknesses and strengths, and who to call when we have a certain thing. and recognize when we need to refer and who to refer to. Does that make sense?
Totally makes sense. So I'm gonna, ask you that question also. I kind of touch in the book Reflex.
Yes.
Many parents hope what frenectomy will solve every feeding.
Oh, yeah. Yeah.
But other being told it's not necessary. And I'm one of those moms. My son has, partial, we can call it, tongue tie, but he was perfectly latched.
Mm-hmm.
Another one didn't have any tongue tie, and then I have to put glucose on my nipple and do all these crazy things he didn't want to latch. So it took us 3 days of fighting finally for him to do that, but I was determined. But
Right.
how do you help family to understand that tongue tie treatment, it's not simply a procedure,
No.
but it's kind of part of a comprehensive functional approach. And this
Right.
is also very special period. Like you
Yes.
don't know what you get, then you got the child who cannot eat. That's very stressful. Child is stressed, parents are crazy. This is so new.
Yeah. So I think that what I like to start out with talking about in this subject matter is that, first of all, it is functional. It's not what it looks like. So I have seen some tongues that look really restricted and everything is working. So if everything is working, then the tongue is going to have the right movement. The airway is going to develop if everything else is okay. This is just part of the picture, right? But if everything is working and breastfeeding is working and there's no major compensations going on and there's no pain, and in my book I have all the lists of things. I have my book here, Tongue Tie for Parents, and I wrote this book exactly for the reasons of this question that you're asking me, because it's overwhelming for parents. And I want parents to understand that, number one, nothing is an emergency, right? So we want to slow down, get educated, if possible, get educated before birth, be prepared just in case, but to realize the importance of breastfeeding for many reasons, but we've never really looked at it for the airway issue reason, right? So in what I have learned, and there's research that supports that the first function that a baby has to do is coordinate the suck, swallow, breathe reflex. So there are some babies that can't even breathe where their nose is. So we're talking about impaired airway from day one. So they may not be able to eat because their nose is obstructed. That may not have anything to do with tongue tie, right? So there's a lot of reasons, but there's a lot of reasons a baby can have trouble breastfeeding, and it could be related to the parents and how they're holding the baby and all kinds of things, milk supply. There's so many factors. So I think that this field gets a bad name when we think that every is a tongue tie. I'm standing here as the tongue tie expert saying that not every breastfeeding dysfunction is tongue tie. We have to look very carefully at the function and rule out other things before we start treating tongue tie. And then when we treat tongue tie, treating is not just a frenectomy or frenotomy. It's not just cutting the tissue. It's supporting everything around it. Right. So we want to make sure, first of all, that the family is ready for this procedure, right? That they are educated. They know what to do. They know what to expect, all of that. Second, we want to make sure the baby is ready. Maybe there's something else going on. Maybe the baby's jaundice, or maybe the baby is not gaining weight and we want to get them a little stronger before we do the procedure. We want to look for other things that are causing oral dysfunction, like maybe there is torticollis or tightness on one side of the neck, or difficulty getting into the position to breastfeed. So all of those things, and like I could talk for hours on this, and your audience doesn't want to hear my hours of talk. So just the point of it is the preparedness and the being prepared for what happens that day and what's going to happen afterwards, and following up with all of the professionals that can support you, especially having an IBCLC, or an internationally board certified lactation consultant, as kind of the team leader or the quarterback, as for the sports reference, of seeing what you need, right? So because the IBCLC usually will have a team in place, usually knows who to refer to, and can assess both the baby and the mother. Whereas the best pediatric dentist, unless they're an IBCLC as well, they don't know how to assess the mother and to see if it's a maternal issue or what maternal issues need support while we're getting baby and mom to breastfeed successfully.
No, this is like when you're talking, you remind me, yes, I breastfeed both of my boys, but that was my goal. I plan to breastfeed them, like they can't say no. But I notice it's a lot of, maybe it's not market enough still.
Yeah.
Even, motherhood is a great thing. People somehow don't feel right doing the breastfeeding. I don't know. I think as a big marketing company market the junk food, maybe we could refocus on the breastfeeding. So I think it's such an important thing, not only the antibody, but the muscle support and the airway.
Well, nobody makes money when a woman breastfeeds. That's a problem.
True.
That's a really good point. Nobody makes money when a woman breastfeeds. And at this moment in time, those of us in the lactation field are very nervous because there's more and more commercial input, more and more advertising for products that actually interfere with breastfeeding or pretend to take the place of breastfeeding. Now, I am not, of course, I wish everybody could breastfeed, but I'm not anti-formula. I am, if you can't breastfeed, you can't breastfeed. It's your choice. I hope nobody chooses just to formula feed, but that's your choice. I'm not into forcing anybody to do anything. However, so many women start pregnancy and have birth and give birth and expect to breastfeed without anybody ever telling them that they're going to have support. They should be preparing for it. They should have a support system in place. They should learn about it ahead of time. Nobody tells them that because nobody's making money from that. Right. So it's kind of sad. And also the reimbursement for lactation is about to be cut in half. There's, the insurance companies are literally battling and cutting away reimbursement for lactation care. It's pretty frightening, honestly. So those of us who support breastfeeding have to stand up and speak louder because
I don't know, yes, I understand nobody makes money, but my goal to breastfeed, I can talk from personal experience, was the antibiotics.
Yes.
I really don't want to cut, I love my boy.
Yeah, I agree.
didn't want to have spend my days in pediatrician office with ear, throat, nose infections. That was my goal. I want to make money on the breastfeeding. Yes, that's how terrible it sounds, but that was my long.
But now you have formula companies telling parents that their formula is just as good as breastfeeding because they've put X, Y, or Z additive in it that's the same. And it's not true, but they're allowed to make these false claims. So that's a topic for another day.
That's a topic for another day, but it's the same thing as good as a potato chips, what are most poisonous for. Same thing as a formula. So, yes. And I want to ask you the last questions. But you work a lot on preparing both baby and parents after the tongue tie release. Can you talk about that? What role of myofunctional therapy, for the baby, lactation support, patient education? I know you mentioned what people have to learn about breastfeeding prior, which is, people spend a lot of money and time on preparing baby showers and now baby reveal. So they spend first half of a pregnancy on baby reveal party, second part on the baby shower. But yes, all this effort would be great to spend on education about.
Yes. Save the money. I think that people should give gift certificates to a lactation consultant.
Yeah, that's a great idea.
And buy my book.
Yes, another book. True. That can be a great gift.
Yes. So what I do mostly to prepare parents is totally revolving around education. First, I want them to understand what's going on what the possible risks are, what it's going to be like. There's a lot of horror stories about stretches and things like that. I want them to understand there are options for other providers, because I love everyone to have some sort of body work. That's a weird term, but for lack of a better word, we use the term body work, meaning chiropractic or osteopath or craniosacral therapy or an OT. Some babies, in my experience, because I've been doing this for so long, I can sort of see which babies need what. But in general, I tell lactation consultants to have a generalized list to give to parents and say, pick one that feels accessible to you, that's in your budget, that's easy for you to get to, that you feel comfortable with, and get your baby and maybe even yourself adjusted, because the tension is not just under the tongue, the tension is everywhere. And sometimes if we get that tension out from the body, the frenum relaxes and there's better breastfeeding. So sometimes parents will choose just to do that and not have a release, and that's treatment as well, with the caveat of, well, just anticipatory guidance of what could happen after, right? Just look out for this, look out for slow down weight gain or pain happening or reflux or whatever, just be careful and keep that going. So I want parents to understand that this is their decision, that this is not about solving problems for the future, because honestly, we don't have any research that says if a baby has a tongue tie release, they're going to speak fine. We don't know about that. We can see that a lot of babies or a lot of children who have trouble with certain sounds have a tongue tie, but we don't know for sure the babies that we released won't have that trouble. So we never want to make that promise. We want to only treat the functional deficit that we see at the time. And at the time of breastfeeding, it's feeding, swallowing, breathing, right? And then also we want to think about, a lot of times I refer to a speech language pathologist who has feeding therapy and oral anatomy in her expertise, because sometimes it's beyond what I know how to do. And I think it's really important, going back to not learning in silos and being able to refer. Sometimes that baby should be seen by a speech language pathologist who understands this, so that we have the muscle training in place. Or maybe they'll say, you know what, don't do this because this baby has something else going on. And that's the expertise. I'm very, very careful when I refer for frenotomy. And I'm more cautious now than I was when I first started, because of the research coming out, because of the defensiveness that we have to have because of the negative press. We want to be sure. And we want to make sure that we're empowering parents to make the decisions. Because otherwise, that's how we stay friends with our patients. We teach them, we empower them, we make them feel comfortable to come back to us no matter what they choose. And I specifically say that to my patients. Listen, if this was my baby, this is what I would do, but this is your baby. And if you decide not to do this and you still have problems, come back to me anyway. No judgment from me. This is your baby and your decision. And that I bring that all out in my book.
No, but this is very nice. I highly recommend all expectant parents to read both of your books. I think that's going to be very valuable. Yes.
Yeah, and the other book, I don't have it handy. It shouldn't hurt to nurse your baby. It's all about simple things to do at home for nipple pain, evidence-based things that, it's not, there's only one little chapter on tongue tie in that book. It's basically about, different remedies to do for nipple pain and when you need to reach out for help. So
this is wonderful, because, you kind of bringing back my experience. And I'm so thankful to lactation specialists in San Barnabas Hospital, what they treat.
Yes.
My older son, to kind of accept that version, because he didn't have any other versions. Yeah, and before the end of the interview, if every parent could understand just one thing about tongue function, breastfeeding, nasal breathing, lifelong health, what message do you want them to hear before leaving the hospital? with the newborn. Like, I like the idea what you said. You actually first, second, but totally like first lactation specialist on my channel. And I highly, I talk about breastfeeding all the time. And I the first time that idea come to me, but yes, it's true. Now when somebody's gonna come expectant, I'm gonna mention to them, maybe, yes, read your book, but maybe even have a consultation with lactation specialist prior.
Yes,
Because
that
they're in a better state of mind
yes.
to accept the information rather than having newborn on the house. So what would be one message you want them to hear before leaving the hospital?
So I would want them to know that they should trust themselves and their own instincts, because there's a lot of gaslighting. There's a lot of people saying, oh, everything looks fine in the hospital. In the hospital's goal, and parents should know this, is just to get the baby gaining weight so they can discharge them. That's their goal. They don't really, and I'm not talking about individual people, I'm talking about the overall goal of hospitals. They don't really care how the baby's being fed. They just want the baby to be healthy and gaining weight so they can discharge them, so they can start taking care of the next diet, right? So you want to trust your instincts. If you feel that something is wrong, find the expert that can help you. And even if the first person you ask says, it's not this, everything's fine, there's nothing we can do for you, keep asking. Well, if it's not a tongue tie, if it's not this, what is it then? There's got to be a reason that I'm in pain. There's got to be a reason the baby's not latching. Keep asking. Feel empowered. You deserve to get the answers that will get you feeling comfortable so that you can reach your own goals, whatever those goals are. Don't give up without keeping asking, finding that help. That's why that leads into what you said, is getting a relationship with a lactation consultant before the baby is key. There's studies that show that leads to more success, because when you're newly postpartum and you're overwhelmed with everything, it's very hard to make that phone call and start a relationship. So have a consult, especially if you have any medical history, if you've had any breast surgery, if you've breastfed before and it didn't work out for you. If you have any problems with the pregnancy that could interfere with breastfeeding, like, gestational diabetes or preeclampsia, high blood pressure, meet with someone who understands how those things can affect your breastfeeding and your milk supply, so that you can be prepared to work through it with the professional. And an IBCLC is the gold standard. There's lots of lactation help, but the IBCLC, we have so many hours. I just had to renew, and it took me 2 days to get together all the coursework. It's so specific and so vigorous, our training and certification. It's beyond anything. It's my hardest certification. I have 3 certifications, and lactation is my hardest to maintain.
No, because you kind of setting up the whole human life with a good start. Now,
Yeah.
what I have to say, yes, it's true, like we're talking earlier, the conversation, breastfeeding, I find very important. I know I said it many times, and I have to say, what I didn't go to pediatrician a lot, my kids are adults, so the breastfeeding, I highly recommend anybody who consider it, and it's just the most rewarding experience. Now, as a dentist, we treat mostly adults, people with a tongue tie. Yes, they usually have a very high sympathetic response. And as a doctor, who practice dental sleep medicine, now sleep apnea has an endotype called PAL. So, certain sympathetic response, arousals, when people constantly in a fight or flight response, a lot of people with a tongue tie, they do have it.
Yes.
They have a lot of clenching and all that. So we don't know all the secrets of book. Science is not a closed book.
Right.
But that being said, yes, I do see the effect of lactation specialist, tongue tie release on a whole.
Yes.
Thank you very much, Lisa, for bringing this topic. And we really enjoy this conversation. I hope it's going to change not one life, but maybe many lives.
Oh,
Because
thank you.
health of the child really affects life of the whole family.
Yes. Thank you so much for having me. I loved chatting with you today.
Thank you.